Hey everyone, Alex here with my capillary microscope. Right here is capillary microscope, and I'm doing an analysis of my nail bed where we can see a lot of fine little vessels and the fine old capillary loops. And what I'm doing here is an assessment of my health of my blood, my circulatory system, especially my microcirculation system, and the reason for assessing the quality of that in one's fingernail, or right below the nail I should say, is because that's the most peripheral area. Most peripheral nerves, the smallest little capillaries have to feed that nail bed. And so the health or the status of that can tell us a lot about the body, especially backing up into the larger blood vessels. I just I've not done a treatment yet with the Avicen 100 here, this microcirculation or vascular treatment device. But I am about to do that. We're just going to do a quick video, though, showing my kind of before and after. Now, this is pretty hard to shoot by myself here, so I apologize for the video quality. It's very tricky to do this on my own, but it'll be easier when I'm testing other people. Anyways, so I can probably zoom this in a little bit better. Let me get that wire out of the way there. Sorry about that, folks. Anyways, okay, so what concerns me most is this upper row of capillary loops. A lot of them are distorted. We also see a lot of bulging thickness. The thickness is good from a certain standpoint, the caliber of it. I'm showing a lot of blood flow. I can see the movement of the blood at a pretty good rate, but some of this top row here does concern me as far as malformed distensions, and then also just kind of the thick globule or buildup in some of these. And there is a chart that comes with this microscope, so you can actually diagnose or assess, I should say, different sorts of health conditions. So I'm going to run a treatment session with this, and we'll see if we see any improvement, especially with that top row. And that's it. Stay tuned for the next video. Thanks for watching. Hey folks, back here, AlexCellFactsReview.com with my capillary microscope, testing my nail bed here. After I just ran a 20-minute session with the Avicen 100 as a vascular treatment device that is approved, FDA cleared for arthritis, muscle relaxation, chronic pain, but does help a variety of other conditions. Anyway, so as we can see, that top row we were looking at last time, what I'm noticing, let me just try to zoom this in a bit. What I am noticing is that that top row that we saw in the other video, it's almost like we have a better shape of the capillary loops. That's the first thing that I'm noticing. I can also see a faster, you can't quite see on this film, but there's a faster blood flow rate as well. There's less clumping or thickness in some of them. But all in all, I'm impressed with kind of just the change in shape. I've also noticed that further down, there's just a greater number of, well, I should say that the capillary loops are more pronounced. They're redder on some of the rows that are further down, showing that just basically overall more blood flow is going to it. But you can see it's almost more of a unified loop again. So that's pretty impressive so far. I already have pretty good circulation, so we'll probably see some more interesting results. Maybe that might even look more substantial with other people that I will be treating with this device, and that also have maybe some known conditions that I don't really have any in particular that that I could say I had a diagnosis on. But anyways, here is a very scientific approach to proving the efficacy for this device for microcirculation. Remember, microcirculation is important, okay, using that device, because that is ultimately what feeds all the cells, even your neurons, as well as takes toxins away, shuttles them away from the cells. So if we can see an improvement again at the nail bed in these fine capillaries and fine little vessels, remember, imagine what that is doing for the whole entire rest of your body. Very impressive. And again, we know there's about a 300 to 400% increase in nail bed growth. So on your nail, you can actually tell if you paint one fingernail, use this for like a couple weeks, you'll actually see a huge growth area where the nail polish is not, and that is your huge nail growth. In other words, the growth rate of your fingernails being hundreds of percent higher is showing you the rate at which your cells are receiving nutrients all the way into the fine capillary peripheral areas of the body. And so they need new cells, and then those cells die, and that's what forms the fingernail. So it's also a great kind of way of seeing what enhanced microcirculation can do in terms of feeding all the cells. Of course, there's much more to the story, but thanks for watching and seeing this little scientific video of mine. If you have more questions about this or the equipment I'm using, or just about the Avicen 100, which is an over-the-counter medical device, please reach out to me, healthhacksreview.com. Thanks for watching. As always, if you have any questions, again, I'm here for you. Alright folks, here we are doing a test with my first client, doing a live microscopic capillary test. And here we are. This is what that looks like. The capillary loops that are being fed by the vessels underneath the fingernail bed. This is the before the treatment with the Avicen, and then we're going to show this again in the same spot after the treatment. Folks, so we just did a 15-minute session with the Avicen on my client's opposite hand, the left hand. And now on the right hand, we're actually going to take a look at that capillary bed again and see if we notice any changes. Alright, so let's see here. Let me zoom in a little bit. Okay. Alright, thanks for bearing with me here, folks. It's sometimes initially a little tricky just to get back to where we were a little bit here. Yeah, it's up there a little bit, yeah. Alright. Okay. Alright, so the first thing I note is there's an increase in flow rate. That's very detectable. There aren't as many breaks in the blood flow, I would say, so it's not quite as coagulated. It's not quite as easy to see, like there's air gaps or breaks. Let me zoom out again here. There we go. So the rate is faster. I also know there's not as much thickness in the caliber. That's the top of the loop, basically. There's not as much of like a pooling or widening at the end of the curve, which again is normally like a sign of the blood being more coagulated, essentially. So that has kind of improved as well. And other than that, there's some pretty healthy shapes here overall. So I'd say that in general, you're in pretty good health. And we'll probably run another series of panels here afterwards. But essentially that's it, folks. Now with this microscope, I will point out over here that what's really nice is that they also will have a little chart to follow along with, so we can actually take a look at and compare what things look like. And in general, these capillaries that we're taking a look at were pretty healthy, and that's what they should be looking at, and there should be kind of clear, distinct rows. But for sure, I have run some other tests for folks, and we do have like sometimes deformed blood vessels or thicker pooling, as we were seeing here. And I've actually seen a lot of this correct itself, usually after like a couple weeks of continuous usage. There is, remember, a 30-day satisfaction guarantee, so a person can use it for 1 month and see if they can actually induce some changes. But I personally have seen that, going from some of these other distorted looks and then basically shifting back over into healthier capillary and healthier vessel shape and flow. If you have any other questions about this video, you can find me on healthhacksreviewed.com. And again, I'm using the Avisense, a medical class 2 over-the-counter device for treating vascular conditions and especially improving microcirculation. Hi everybody, Alex here, healthhacksreviewed.com. I'm here with a new client, and this is the Avicen 100. We're actually checking the right hand here with this capillary microscope, and we're doing a before and after. Just doing a quick analysis of the different capillary loops here in the base of the nail bed. And we're testing that again, remember, because this is a fantastic device for vascular treatment and affects microcirculation even all into the fine capillaries and vessels of the fingers. So we will be treating the left hand only in the device and show that changes actually occur all the way in the right hand just over the course of a 15-minute session. So I'll just kind of try to zoom this in a little bit better. But essentially blood flows currently a little slow. We do see that the loops are a little faded out near the base, and there's a little bit of coagulation near the end of the loop. I would say that this is something that we'll basically pay attention to see if this clears up a little bit. And let me just zoom up a little bit, see if we catch anything up there. Nope, pretty much. So we'll check back with this after the treatment session and see how things progress. Alex here with client number 2, doing the capillary microscope test after using the Avicen 100 class 2 device for vascular treatment microcirculation. Here we are with the capillary microscope, and this is after a 15-minute treatment. Again, we treated the opposite left hand, and over here we're testing the right hand. So let's see. One thing that I am noticing is there's just a lot more visible in general. I'm seeing much more of not just the loops themselves, but I'm also seeing like lower on their tail end of things. They seem to be a lot longer, or at least they're becoming more visible. So there is in general more blood flow that we're noticing. Also the speed, again, the flow rate is pretty good from what I'm seeing. But in general, overall, I'm just kind of impressed by how much more prominent these capillary loops are. So that's really nice to see. And in generally, the caliber on the different sides, it has to do with the thickness or the diameter of the tubes, also I've been noticing is a lot thicker. I think this is visibly beautiful compared to the first video before doing the session. And remember, again, this is just for one treatment session. The individual user recommending doing 2 treatments a day, so this will basically continue to improve really over the course of using this. And as you know, there's a risk-free trial for 30 days, so you can actually track your progress. And if you have any questions about this, reach me on healthhacksreviewed.com. Thanks for watching.